Good afternoon, everybody. So my name is Jim Shames. I'm the health officer for Jackson County. I'm going to read you prepared statements so that I can be sure you have all the information you need, and then we can have questions and answers. So I really want to thank the press for coming. You all are really important partners to us. You help us balance our needs to work in this response and the need for the public so that they can get accurate information. It's a rapidly changing environment we're in, and the media plays a really important role. And so thank you for being here. So the situation in Jackson County, we reported 2 presumptive cases of COVID-19. This occurred on March 7th. We have no new presumptive cases to report at this time. Importantly, these were travel-related, and there's no identified risk for the general community. In Jackson County, there's no known spread of COVID-19 at this time. We do expect more testing to be available soon, and with increased testing availability, we expect we're going to see more cases in Oregon and possibly more cases in Jackson County. And the importance of that is it'll help us identify sort of where the disease is spreading and where we need to place our attention. COVID-19 is a reportable disease in Oregon, and this means that as tests are pushed out to private labs, that we will still know who's positive and who isn't. So what we're doing, Jackson County Public Health continues to perform case investigations, and we monitor people who've been identified who might have risk of COVID-19 exposure based on travel or contact with a known case. We continue to work with our healthcare systems, and we coordinate all our responses with them when we're able to do that. We appreciate their patience and flexibility, and we do our work and guidance with the Oregon Health Authority and with the CDC based on current science and lessons learned from other countries and areas where the disease is prevalent. So, what do we know? The virus is thought to be spread primarily from person-to-person contact through respiratory droplets. It's produced when an infected person coughs or sneezes, and generally the risk is for people within 6 feet of the individual who's coughing, and we generally expect that there needs to be exposure for perhaps an hour worth of time. When sick people are not wearing a mask and they cough, these droplets can land on objects, people touch these objects, and then you have the possibility that the virus is on their hands, and they can touch their eyes, nose, and mouth, leading to someone becoming ill with COVID-19. So because of the current situation, what do we know? We continue to work with facilities on preventing and mitigating the spread of COVID-19 by having basic infection prevention strategies in place. We're asking the community to take action to prevent the spread. We know that about 80% of people who end up infected will not have severe complications. So our goal is to protect older individuals, those with underlying health conditions, who are at risk of developing severe complications. And if we can keep the number of individuals needing higher levels of care to a minimum, that allows our system to continue to operate efficiently and will allow us to be able to respond as the virus moves its way through our community. We want to avoid being around well people, older adults and people with chronic health conditions if you are sick. Those who you know who are in these high-risk categories, the elderly, et cetera, we should check with them, make sure that they have their needs met so that they don't, again, have to end up with a higher level of care. We want to avoid people who are sick. People with mild symptoms are encouraged to stay home and recover. If your symptoms should worsen and you think you need more advanced medical care, we want you to call ahead, talk to your healthcare provider, or if you need to call 911, explain to them what your symptoms are so they can adequately protect themselves when they're dealing with you, and expect to have a mask placed when you do seek that care. All of this is to protect others from catching your illness. If you have to go out in public or to a medical appointment and are sick, we encourage people to put a mask on, but otherwise, masking, just walking around when you're well, is of no proven public health benefit, and in fact, it means that you're using a resource that probably could be used by someone else in need. Washing your hands with soap and water for 20 seconds is the best option. If soap and water are not readily available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. You may have noticed when I used this at the beginning that you need to be thorough. You need to get all surfaces of your hands, your thumbs, the back of your hands, and your fingernails. So, time to start getting more aggressive about our hand cleaning. Do not touch your face, eyes, nose, and mouth. The last time I did this, I was told I touched my face 4 times. I believe I have not touched my face at all this time, so we can get better at this. Clean and disinfect frequently. Touch surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, phones, keyboards, toilets, faucets. And really most common EPA-registered household disinfectants will work. Frankly, soap and water will also work. It's not recommended that people who are well wear a face mask. I mentioned that earlier. You're not really doing yourself any good. However, if you do have to go out in public, it's good to protect others from your cough. And I think with that, I'll open it up to questions. Yes?
Quick question here. The Phoenix Talent Schools released a statement saying that a member of the school community may have been in contact with somebody out of state who may have COVID-19. That school that they're now disinfecting thoroughly is Orchard Hill Elementary. I'm sure this was an attempt to be transparent, but where is the line between transparency and causing fear that maybe is unnecessary?
Right. That's a really good point. The other thing to consider in terms of transparency is whether or not you may be violating someone's right to privacy, which is paramount for us. We have no known suspicious contact in the schools at this time, and we do appreciate that the schools and the administrators are being careful and doing their best to protect children and the public. But we have nothing that we know that is putting any school children at risk at this time.
And how long is OHA taking to give responses to the tests that are sent to them?
They're pretty stretched, and they do have criteria for prioritizing the tests that come to them. I know they're working really hard, and as soon as they have a result, certainly as soon as they have a positive result, we get notified immediately.
And if there is kind of a backlog or something like that, are you guys considering doing any kind of testing here locally, maybe outsourcing to somewhere else?
Yeah. Things are changing by the day. You know, if we had this conversation a few days ago, we would not have had availability of any other testing mechanism, and now we do. I think we're going to just see how it, see how things change and what the need is. We're certainly trying to be responsive to the need, and if there are gaps in the community healthcare system that we could fill, we will look at that.
And how many tests are we able to do per day?
I don't know that we truly have a limitation on that. It's not that easy to do the test. I think we talked about this once before. You need to, if you're the person doing the test, you need to be dressed appropriately so that you don't get infected at the time you're obtaining the specimen. So there's that limiting factor, and the tests are not widely available, so there are criteria.
If the situation gets worse, could we be looking at public testing centers for people to come in and get like some sort of rapid testing?
Well, rapid testing would be a technology that we just don't have available yet. The test would have to go back and come back. But in terms of getting the tests performed, we have been discussing with our community partners ways in which this doesn't have to be terribly impactful to any particular provider or the patient. So we are thinking about ways to get people tested when they need to be tested.
Are you able to update us on the people that are kind of in their homes under quarantine? Are you able to update us on their condition, if they've worsened or getting better?
No one has been hospitalized in Jackson County with COVID-19.
Has the CDC confirmed both of these cases?
I don't believe so. I mean, we're assuming that all the problems with the testing have been more or less worked out. And so I think the assumption is if it's positive at the state lab, it's going to be positive at the CDC. I'm not even sure that that information will trickle back to us. It certainly would if there was a discrepancy, and we haven't heard that.
Dr. James, what's the criteria for testing? There are a lot of people out there and they might have a cold, maybe it's got a persistent cough, seems to be more severe than the normal cold. What would trigger actually getting a coronavirus test?
Right. So the criteria for testing initially were very quite tight because we had very few tests. We now have more tests and the criteria have loosened up a bit, and now we have testing through private labs, and we don't really have control on that. The recommendation would be not to just test somebody because they want to be tested. Essentially, somebody who has symptoms of a lower respiratory infection, so they've got fever and a dry cough, and you've already ruled out influenza, right? Now you're beginning to kind of go down the road of what is this? And certainly somebody who's sick enough to be hospitalized, those would be people you would want to test. And we probably will be loosening those criteria up as tests are more available.
Do you think people might be afraid to seek medical care because what if they went in and they don't know what the criteria is, or if their doctor will test them for coronavirus and they feel like I can't afford to be off work quarantine for 2 weeks and have my kids out of school? Yes,
that's always the balance in trying to provide safety, but realizing that people live in the real world. It's a sacrifice. Everybody has, maybe asked to make some kind of sacrifice, and for more people some people would be more significant a sacrifice than others. If in fact you have coronavirus, the risk to the public is significant, and those people will need to be quarantined. And frankly, if you have a fever and you're coughing, even if you don't have coronavirus, you probably have something that is contagious to others, and the principle is the same, that the fragile members of our community could get very, very sick with something that you'll just weather and move on from. So the principles here are not that different than principles with other similar infections.
There have been a couple people from the area that are on a cruise ship that is docked near Oakland. Are you guys in contact with them as they move into quarantine and then move back to the area?
We're notified through mechanisms through the CDC of individuals that have traveled that are at risk, and we're not in daily contact. We assume that the system will work and that we will be notified, and I suspect that those individuals were also told to contact us, so that one way or another we're hoping that when those folks come back, and if they come back to our community, that we'll be all set up, we can do quarantining and we can monitor them on a daily basis.
I know we're not at the point of social distancing yet. There might be some preventative measures where that is occurring, but could you talk about the importance of personal space, maybe not shaking hands? We're
Right.
seeing a lot of fist bumps now, elbow
Right.
touches, or a
Right.
wave.
Right. So the disease is spread by coughing or sneezing and having those droplets go out 6 feet from you. They fall on inanimate objects. You touch them, you touch somebody else, they touch their face. That's how we get infected. So the ways we can minimize that is, one, through changing some of our social behaviors. I don't think I've touched my face the entire time. And to wash your hands frequently, wash surfaces frequently. As far as the distancing is concerned, there's a lot of talk about how do we achieve that on a voluntary basis at this time. And I think some of the criteria you might use would be, is the event going to be outdoors or indoors? Is there any way you can create a situation where people are further apart? Perhaps you were going to have food, but now you're not going to have food. Is there an outbreak in the community on where this is going to happen. Are there likely to be people coming from an area where there's an outbreak? So it's kind of fluid now, but events are being canceled out of an abundance of caution, and I think that's likely to continue. It might get more significant. There might even be events that are mandated to be closed. But at the moment, we're still doing it on a case-by-case basis.
Dr. Shames, could you speak more about, is it more safe to go to an outside event? Like, should you consider going to a farmer's market, but maybe hold off on going to some sort of indoor event?
Yeah. So if you're going to go to an outdoor event where there's going to be a lot of people touching the same thing you're touching, that may be different than if you're watching a baseball game in the bleachers. But yes, in general, outdoor events would tend to be safer than indoor events. But I guess the point I want to make is you kind of look at the situation, ask yourself, how is this disease spread? Is it likely to occur at this event? The only other thing I would mention is that some of these precautions are more significant for some of us than others. So if you're 80 years old and you have cardiovascular disease and you're asking yourself the same question, you may be much more conservative about going out and putting yourself at risk than if you're young and healthy, because the disease has a very significant curve in terms of severity, so that children rarely get sick, and the fatality rate is close to 0 for those under the age of 20, whereas it could be as high as 15% for those over the age of 80. So in terms of risk management and what people need to take for themselves as they think about whether they want to take the risk or not, those are important considerations.
Yeah, Dr. Shames, Senator Merkley sent out a press release, and he's concerned about the transmission of disease inside jails and prisons. We have a Jackson County jail. There's tons of turnover. It's a well-known issue in the community, and we know that people who go to jail because of addiction and sometimes mental illness, they tend to have worse physical health and mental health than the average population. Are there special precautions being taken for the jail to protect the inmates and the staff and the family members?
We're concerned as well. There's a lot of populations where people are in confined spaces. They're at risk. Think nursing homes, jails, homeless shelters. And each of those situations, requires, kind of different kinds of planning. We are in discussion with the jails about what can be done to try and keep the inmates as safe as possible. They do have jail health. They have negative pressure rooms in the jail. That is a way to prevent the potentially infectious air from circulating throughout the jail. So they have some things in place. They have strategies that they've worked out over the years for how to handle this, and we plan to have meetings with them. And I can't tell you all the things we're going to work out, but we're aware of the issue.
And how long can the virus, let's say it's coughed out onto a doorknob or a computer, how long can it stay alive and possibly be picked up by somebody else?
Right. So this is called novel coronavirus, and novel means we don't know much about it. It's brand new. So we're learning as we go. If it behaves like other coronaviruses, it probably doesn't live on inanimate objects longer than a couple of hours. Since we don't know, we're saying a couple of hours to a couple of days. We do know that it's a fragile virus. It doesn't, it doesn't hold up well to almost anything you might put on it. So alcohol-based solutions, dilute ammonia and other solutions, and soap and water will kill it.
Any other questions?
Okay, thank you all for coming.